The client has a medical diagnosis of hemiplegia or weakness and hemiparesis or paralysis due to a cerebral infarction affecting the right dominant side. The client experienced a CVA due to an occlusion or blockage of the left middle cerebral artery. With the CVA of the MCA, the right dominant side of the body is affected. The patient suffers from comorbidities of hypertension, hyperlipidemia, hyperthyroidism, and osteoarthritis. This could potentially affect the treatment sessions. The client has hypertension or high blood pressure. While treating the client, we must ensure that the client's blood pressure does not rise above unsafe levels. It is important to make sure that we check the client's blood pressure before, during, and after any treatment activities. The client also has hyperlipidemia, or high concentration of fats or lipids in the blood. This will not affect our treatment significantly. The client also has hyperthyroidism, or a decreased production of thyroid hormones. This also will not affect our treatment significantly. The client lastly suffers from osteoarthritis, which causes an inflammation on the joints and bones. This can cause pain in joints, especially in the hands. This is important for us as OTAs to note and make sure that the client is not in pain during our treatment session. Precautions that need to be considered when treating the client would be that the aphasia that she is experiencing. Aphasia is the loss of ability to understand or express speech. This could allow for the client to not be able to express pain or discomfort throughout the treatment. It will be important to ensure that the client is not in pain and that the client is not having further complications. The client can follow one-step commands, and it is important to continue to ask the client if she is in pain at all. We can also see if the client is in pain due to her facial expressions. The client is on a puree or nectar diet. This is important when the OTAs address the ADL task of self-feeding. We must ensure that the food is the appropriate thickness for the client so that the client does not choke on the food. With a stroke, the clients are not able to swallow, so having the right thickness of the food will help with that process. The client will be attending therapy sessions 5 times a week for 30 days. The client's potential is good for recovery because of her independence prior to the CVA. At the beginning of the treatment, I will focus on a sitting balance with the client. The client is currently unable to maintain her balance without support and requires maximum assistance. If the client can maintain balance, she will be able to perform more of the functional activities. I would achieve a balance goal by using therapeutic activities and wheelchair management. I would ensure that the client's blood pressure is being checked throughout the activity. For the activity at the beginning of the treatment, it would be that the client would be seated in a chair that does not have any arms, and that the client has a gait belt and the OTA will have a hold of the client the entire time. The client will shift their weight from side to side, then lean forward and then back, leaning down with elbows on both sides, reaching forwards with the weak side and then reaching forward with the dominant side, and lastly reaching forward with clasped hands. The second goal I would focus on would be to decrease the tone in her right upper extremity to decrease the pain in her upper extremity dressing. The patient currently exhibits severe impairments in her right shoulder and elbow and would like to be reduced to moderate impairment. I would reach the goal by performing ultrasound therapy on the client to minimize the pain. This will also allow the muscle tone of the client to decrease and minimize the pain in the shoulder that could be caused from the increased tone or from the osteoarthritis that the client has as well. When using ultrasound therapy, being aware of the precautions and contradictions is important. It is important that the client skin does not become warm because blisters may occur. The client has loss of sensation as well and may not experience the pain that may be caused. To achieve this goal, I would like to use electrical stimulation as a manual approach. The client has loss of sensation in the right upper extremity, so with the manual approach, the OTA will have to ensure that the client is not experiencing any negative contradictions and that the E-stim is appropriately moving the muscle bellies that are being addressed. For the E-stim, I would begin by improving muscle tone. The electrodes would be placed over the muscles that are being educated, and to start, I would begin with the trapezius and work my way down the right arm to the triceps. It was noted that the increased tone appeared as if the client was actively resisting movement. As the treatment progresses, the client will begin to work on neuromuscular reeducation, and that will be addressed using e-stim, and that can be unattended once the correct parameters are found. The third skilled service I would address would be self-care training, in which the patient would achieve the goal of washing and drying her face with moderate assistance while seated in a wheelchair. The client currently requires maximum assistance to wash and dry her face while seated in a wheelchair. I would do this after the tone in the upper extremity was addressed so that the client would be able to move the arm slightly to perform the activity with moderate assist. The last goal I would address would be for the client is the goal to effectively use a left curved spoon to feed herself for 50% of the meal. The client is currently able to feed herself after setup using a left curved spoon for 25% of the meal, requiring minimal assistance. The client will be using her right hand since she is using a left curved spoon. The client must still eat puree and nectar foods while using the spoon. This will be until the client can regain the ability to chew and swallow the foods again. This will be addressed using a skilled service related to the self-care training. I will be performing a balance activity with my client at the beginning of the treatment with her. I will grade the activity up by having the client sit on the edge of the bed on not such a firm surface to perform the activities. To grade the activity down, I'll have the client remain in her wheelchair and complete the activity there, where she will have armrests for additional support.